Have you ever heard of CQI? Continuous quality improvement. It's getting a lot of hype these days. But do you ever wonder exactly what CQI is? One definition is that CQI is an overarching philosophy or framework within an organization that drives the daily work activities of all employees. The management philosophy of CQI then supports the implementation of quality improvement practice. Okay, so now we know what it is. But if you are like me, you are now wondering, who is using CQI and how are they doing it? Continuous quality improvement has been discussed in Ontario public health units for over a decade. In fact, CQI's importance as a part of performance management was recognized in 2006 by the Capacity Review Committee, and it is now included by the Ministry as a required activity for public health units. The problem is that CQI in public health units looks different across the province, making it difficult to share information, learn from each other, and develop common standards of practice. So, how are public health units in Ontario doing CQI then? This is what we wondered. So we got together and formed the CQI LDCP group, and this is our story. We are a team of public health professionals from across the province, and we wondered, how can systematic continuous quality improvement be strengthened within Ontario's public health units? We wanted to be able to bring Ontario's public health units together to describe what CQI means for them and how they can move forward together in a clear, consistent way by identifying the drivers and attributes of CQI that are applicable and transferable to Ontario's public health sector, and by describing the current state of CQI in and across Ontario's public health units. So we embarked on a CQI research journey, and the results are amazing. Our research included two main components: a scope and review of the literature using a 6-step methodology, and the implementation of a QI maturity tool, the modified Ontario version. 5 main domains and several supporting enablers for implementing CQI that could be considered in the public health setting were revealed in the scoping review. These 5 main domains and supporting enablers include innovative, non-punitive culture where CQI is aligned to the overall organizational vision. Organizational supports such as QI training, hiring and performance review practices that are aligned to the CQI principles, ensuring appropriate internal funding and resources to support QI work, and to focus on the implementation of multidisciplinary teams. Leadership for QI is necessary at all levels of the organization, from senior leadership, middle management, QI facilitators, frontline leaders, all of whom have varied responsibilities. Leveraging existing data and related systems, and ensuring that data is robust and credible and available in real time. External supports for enabling QI were quality improvement collaboratives, accreditation, certification, and external funding and resources. Through our maturity tool survey, we discovered we weren't the only ones interested in what CQI looks like across public health units in Ontario. That means other public health professionals were wondering the same thing. Let me explain. In Ontario, there are 36 public health units. Of these, 34 participated in our maturity tool survey. From these 34 health units, 3,503 staff took the maturity tool survey, resulting in a provincial response rate of 46.6%. The average score for all participants from Ontario public health units was 4.94. This places the provincial average in the emerging stage of QI maturity. The survey results suggest that participants place a high value on QI, but collectively are at less mature stages of QI in relation to QI organizational culture and the competency and capacity to engage in QI activities. By now you might be wondering, why is this CQI research journey important? And why are you telling me all of this? Well, I have an explanation for that too. This study has identified enablers of the CQI management framework in 5 domains that together support the implementation of QI in health-related organizations and may be applicable in the public health setting in Ontario. Our goal is to advance CQI within and across Ontario's health units with evidence-based applied research grounded in the experience and perspectives of those working in the field of public health. The results of our research help to enhance public health professionals' understanding of the current state of the implementation of QI in Ontario. So, what's next for our team, you may be wondering? Stay tuned, because the excitement does not end here. Up next, we will use our results to develop the next research proposal to identify and/or enhance specific tools, systems, and structures that support CQI within and across Ontario public health units. Now that is what I call CQI.